Hello, and welcome to this Clinical Care Options podcast episode. This episode is a featured component of an educational program titled Optimizing Patient Outcomes in IgAN, Expert Guidance on Evolving Management and Treatment Options. I'm your host, Kim Neely, and today I'm excited to be joined by amazing guests who are both experts in IgA nephropathy. Dr. Pietro Canetta is an associate professor of medicine at Columbia University in New York, New York. Dr. Canetta focuses his clinical and research endeavors in the area of glomerular diseases. Kelly Chen is a nephrology nurse practitioner at Stanford Healthcare in Palo Alto, California, and is also a patient living with IgA nephropathy. She serves as a medical and scientific advisory board member and as the Asian American Engagement Director with the IgA Nephropathy Foundation. To find more activities on IgA nephropathy, including a CME certified text module, clinical thought commentaries, and more, visit clinicaloptions.com or visit the link in the show notes. Now, I'm excited to hand it over to our guests.
So hi, I'm Pietro Canetta. I'm a nephrologist at Columbia University in New York City. I specialize in the care of patients with glomerular diseases like IgA nephropathy. I'm here today with Kelly Chen. Kelly Chen is a patient with IgA nephropathy. Hi, Kelly.
Hi, Dr. Canetta. How are you? I'm Kelly. I'm a nurse practitioner by trade, but I'm also a patient with IgA nephropathy. I started off with my work in the medical ICU. I used to work in New York City as well, and had to take some time off. I was quite burnt out through the pandemic, and after taking some time off, I actually found myself in nephrology, and a lot of that was inspired by my own diagnosis. So now I'm a nephrology nurse practitioner here at Stanford, but also I live with IgA nephropathy every day.
So Kelly, you have a very unique perspective in being both a patient and a provider. Why don't we start at the beginning? Why don't you tell us a little bit about your experience being diagnosed with IgA nephropathy?
Yeah, I'd love to share that. I was diagnosed in 2018. That was when my kidney biopsy was. I was still, so if we back up a little bit, in 2017, September, I had just started the latter portion of my nurse practitioner program. I was in Philadelphia at the University of Pennsylvania. I was in actually a preventative cardiology course, learning about familial hyperlipidemia and thinking about my own personal story. I was like, I probably should be on a statin. I had high LDLs. As a kid, my father had his first heart attack, my MI, at 38, and then proceeded with a CABG later on when he was like in his 50s. So I ended up seeking care at my local student health. I saw the nurse practitioner assigned to me later that fall semester. Started on a statin, and as part of routine follow-up, we had to check LFTs. And that was sort of the can of worms that opened up into my diagnosis. I had low albumin. The nurse practitioner sent a urine sample off, ended up doing 2 24-hour urines into January of the next year, sent me off for, of course, a renal ultrasound. And very soon after, got me a referral for University of Pennsylvania nephrology. So I think during that first visit, it was really just, okay, you're a 27-year-old East Asian female with blood and protein in your urine, with 2 24-hour urines, couple urine UAs, probably have IgA nephropathy. We should do a biopsy. So within like 10 or 15 days, it was the day before I walked for graduation, May of 2018. That was when we scheduled our kidney biopsy. Kind of a very slow beginning, but then still was quick to get to diagnosis.
Now, did you ever have any inkling before all this happened that you might have had a chronic disease or a kidney disease? Had you ever had any symptoms beforehand?
No, not at all. Completely asymptomatic. I feel incredibly lucky um, that we were able to identify this early, given how silent it was. I had 3.4 grams of protein. So for
That's
sure,
quite a lot.
significant amount, but no symptoms, which
Yeah.
is a blessing as well. But I don't know if we would have discovered it otherwise.
Yeah, it's interesting that you say blessing. A lot of people say that's the blessing and the curse of kidney disease, is that without symptoms, initially it doesn't impact you very much, but at the same time, it can be hard to diagnose. I think a lot of patients have this experience of being found, incidentally when a test is done for another reason. So it was good of your student health care services to pick up on the kidney disease aspect of this. So
100%.
now you get your kidney biopsy and you're told IgA nephropathy. Did you know anything about IgA nephropathy before this?
No, my sister was in medical school. I think she was in her like second year. So I was like, and we don't learn this in nurse practitioner school. And all she knew was, oh, it's also called burgers. I think it's like a common thing that medical students are taught.
And do you remember, did you look online or did you ask her? Or where did you get your information about the disease early on?
Yeah, I think I Googled it naturally, like every patient. And then, you know, it was only the very, very creme of the material on Google.
Okay.
Very confusing, even as an NP student. Um, and then I went to Up to Date, which is a common place where a lot of providers will go to learn about a disease.
It's like an
All
online textbook essentially. Yeah.
Yeah, like an online, Doctor Wikipedia.
Yeah.
Um, and even that was really difficult for me to completely wrap my mind around what was going on in my body, why I was making blood in the urine, why there's protein in the urine. I think because it was such dense material, I just kept putting off actually reading about it, even though, I had some, for sure, like a little bit of healthcare background,
Yeah.
try to understand, the pathophysiology and like what's going on.
Yeah, it's
But
impressive how,
so
you have a healthcare background, you have a physician in the family, but this stuff is still, very, very esoteric. And I think a lot of healthcare providers feel the same way. They don't know a lot about it and struggle to understand it.
yeah, 100%.
So now you have your biopsy, you have your diagnosis, you're learning a little bit about it. Where did you go from there? What did your doctors at Penn tell you, and how were your initial treatments?
I think right off the bat, I was started on a RAS blockade. So I started on lisinopril, an ACE inhibitor. And then we titrated it to my diastolic blood pressure was a little high. I think it started off in the 90s. And so we just kind of went up as high as we could to before I got lightheaded or dizzy, and before blood pressures would get too low. But even then, it didn't really bring down my proteinuria to less than 2 grams. Um, and so I think early on, I didn't know what to expect. I knew that I had to get my protein less than 1 gram. But I think I wasn't taught that until I moved to New York City, and transferred to nephrology departments. Um, so the first couple of months was just being on the ACE inhibitor. I just graduated from, Penn, from the NP program. There was definitely a life change. I knew I wanted to be in New York with my long-term boyfriend at the time. Um, and so I kind of just spent most of my time like transferring all of my life to New York, looking for a job, studying for boards, applying for boards. And then it was, I think, August of later that summer or September, where I was reestablished with nephrology in New York, and started on prednisone.
Okay. So that I think prednisone is one of the more common, stronger medicines used for IgA nephropathy. It's a pretty potent anti-inflammatory. Has a lot of side effects. Do you remember what your experience was like going through it?
Yeah, I also had a lot of side effects. It really affected my board studying. I had to push off my boards twice. The first time I just couldn't focus. I couldn't get any sleep. I was on 120 milligrams every other day in the beginning. So all I wanted to do was go to the gym, lift weights, and explore New York City. Like there was just no way for me to sit down and study for boards.
Yeah. Did it so it that's a common thing that it affects people's sleep and their attention. Did it affect your weight or your skin?
Luckily, it didn't affect my weight or my skin, but it really affected my relationship with my boyfriend. He was busy with work. And I think like later October of that year, we got into the biggest fight of our lives
Oh
and
gosh.
we were together for like 6 years. And I just was like, I want to end this. Fortunately, he had known me for so long and just knew that it's the meds talking.
Right.
Uh, and, as a healthcare worker and he's not in healthcare, I was like, no, you're lying to me. And so it was a constant back and forth for a very long time. And luckily we stuck it through and, now we're engaged, but it was forever in my mind as like, these are crazy, crazy medications.
Yeah, that's really interesting. A lot of patients who are on prednisone, you'll say, "How are you doing?" And they'll have some symptoms and they'll tell you about them. And then sometimes if you have a spouse or a partner, they'll say, "Oh my gosh, like it's such a personality change." And it's not the patient telling you, it's the partner. So it sounds like that might have been your case as well.
Yeah,
So you were on
super.
the prednisone for about 6 months.
Yes, 6 months.
And do you remember coming off of it, how you felt?
Not really. I think I just was happy that I wasn't doing anymore because of that really embarrassing experience with my partner at the time.
Yeah. And how was the disease responding to the treatment?
Well, my protein dropped for the first time less than one.
Okay. And so that's a great response to go from starting above 3 to then less than 1. So then, but that wasn't the end of it, right? I mean, you still living with
No.
IgA nephropathy, you still have some protein. And tell us a little bit about kind of the how the disease progressed or changed over time.
Yeah, so it dropped to less than one. Um, we continued to trend it through the next year. This is now 2019, early February 2019. So a couple months later, you would see the protein start climbing up again over one. And I think at that point, that was when we were started talking about clinical trials. Um, Fortunately, I was in a big city. I was offered a clinical trial. Um, but because, so I went through the screening process and then afterwards, I think just logistics, we realized that we were within 12 months of the prednisone. And so I got screened out at the very end, which was really unfortunate because I knew that like I needed to keep pushing and do something about this proteinuria. Um, I was shown graphs that, if you don't bring down the proteinuria to at least less than 1 gram consistently, I would end up on like renal replacement therapy within 10 years, 15 years from diagnosis. So I just felt like there's this constant timing thing where if I don't push myself or I don't push for more treatments, um, I would be doing myself a disservice. So that was the first time I got screened out. The second time I got screened out, it was the pandemic. We were in the midst of things. I was working in a medical ICU at NYU, Langone. So we're really busy, doing just like taking care of COVID patients. Research sites got shut down. So that all ended up getting pushed back until 2021, where I got screened out again for the third time on the same trial, because my GFR was too high on this like one day that I did my 24-hour urine or my blood studies that day. And so unfortunately, just three times I was like, yeah, I think that's good. Fortunately, at that point, other trials had also come online with the pandemic ending. But truly, it felt a huge delay, looking back from 2019 to 2021, where wasn't really doing anything. And so I actually ended up flying to China end of 2019 before the pandemic broke out because I felt like I wasn't doing anything for myself. My parents were incredibly worried. We had attended a NIDKK like patient panel conference in October, or I think it was like September 2019,
Yeah.
and learned that there was these traditional Chinese medicines that folks were using in Asia. And it kind of opened this whole new world that there are so many Asian patients battling this IgA nephropathy disease. And why not go back to the motherland to kind of seek care there, since I wasn't able to get any treatments in the US. And so long story short, I was doing traditional Chinese medicine through most of the pandemic, until I could get screened for a new trial in 2021.
Yeah, I think that really highlights how limited the options even at that time were. I mean, you were on one medicine, right? Lisinopril and maybe a statin. You'd been through prednisone, and prednisone had a good effect, but it didn't cure you. And so now that's sort of that's all medicine can offer at that time, and you're desperately looking as a very motivated patient for other options. And good for you for getting into clinical trials and looking there. But I think that your experience of looking for other things, and China and other types of medications is a pretty common one. I mean, how often do you think, at that time or now, like how often do you think about having IgA nephropathy or being an IgA nephropathy patient?
Daily, multiple times a day. I mean,
Yeah,
you have to, because it's a chronic disease, and if you don't think about it, then you're not providing any self-care for yourself,
yeah.
uh, and then you're just letting go. I mean, I'm a very motivated patient, so that's the way it is, but it can definitely drive a lot of anxiety as well.
And how would you say that affects your life? Because, like you said before, there's not a lot of symptoms involved, but you're still thinking about it all the time.
I think I worry that because there are no symptoms, then I do less for myself. But if there were symptoms and it wasn't a silent disease, maybe like I would be forced by this disease to think about it or make changes or ask for help. But yeah, it's just a relationship of me with my numbers.
Yeah. What are the types of things that you worry about?
I worry about family planning. I was diagnosed at 27, and I actually had seeked for OBGYN to bank my embryos at 29. Early for sure, and things can happen,
Yeah.
and I was so early in my disease course and I had very little understanding. But time flies. Most folks, if you're a working woman, you're getting married later, you're having babies later. Um, and so now I'm kind of going through that same process that I initiated back when I was in New York, when I was 29 years old. Now I'm 33. I'm about to freeze my embryos in a couple months here, um, because I'm just not ready. But, what if my kidneys can't wait any longer, or the risk of progression gets higher when your creatinine is higher?
Yeah.
And so you have to kind of open the opportunity of, do I need a gestational carrier? Can I have a second child? Can my body handle the first kid? Probably, but then do I want a second kid? And so I think that changes a lot of what my envisionment of my own life to be.
Sure, you're not just thinking about the types of things that you or you and your partner might want, but also how it might affect your health. Yeah.
Yeah.
So what would you say? I mean, you've been through the gamut of being on different medicines, being in a clinical trial. Now, out of the clinical trial, are you still in it, or did you finish it?
I'm in the open label portion.
Okay, all right. So still getting not entirely experimental, but somewhat experimental medication for the disease. So what would you say? What advice or what words would you have for other patients with IgA nephropathy who maybe are not as savvy about healthcare, or maybe they've just been diagnosed and they're just sort of starting their journey?
I think that this is actually the best time to get diagnosed with IgA nephropathy. Super exciting time, lots of opportunity and choices that can be made together with your provider. I was not at that position, and I was only a couple years away before more opportunities presented themselves. But in the beginning, it was definitely a scary time.
Yeah, it's amazing what just 5 years difference, how many, if you were looking for a clinical trial now versus back then, how many more options you have today.
Yeah, I think options are, it's freedom to
Yeah,
make. Whereas, but previously, I just felt cornered. There was just no options.
yeah. Well, thanks very much, Kelly, for sharing your experience. Any closing thoughts you have, or words for other patients with the disease?
Yeah, follow your labs, stay engaged. You may not have symptoms like me, and it's okay. But don't let go of those labs. I think the urine and the protein in your urine is important.
Well, those are wise words. Yeah, follow your labs, because even if you're not feeling it, and things can be happening. So I'm glad to hear about how engaged you've been, and it sounds like it's had success thus far, and hopefully we'll continue to see success in your case going forward.
Thank you.
Thanks.
Thank you so much to Dr. Canetta and Kelly Chen for joining us for this very important discussion about the patient experience with IgA nephropathy. And thank you for listening. As a reminder, visit the episode notes or clinicaloptions.com to find more educational activities on IgA nephropathy.